neeku esiai oonkishu kitii neeku naa nejia. Neeku iyiolo naa iyiok esiai ang' naa esiai oonkishu, mikiata iyiok enkae siai. Yiolo naa ninche iyiok kiata naa faida tukul amu eneng'as ninye kuna kishu aisho nikiok kule nikimirr toi aaku ninye epuoyie nkera sukuul nenyai tii nkiri neeku kidolta naa faida ajo olee etii faida naleng'.
Ore sii iyiok faida nikitumito tina ramatare ang' kimirr enkiteng' netum iropiyiani kumok amu erropiro enkiteng' amu etasha naa Enkai neeku etaraposhe olari. Ore saai etaa olari nikitum sii iyiok kule nikiok metaa mikingil aapuo aanyamaliki kule aikunaki taa nejia.
Yiolo naa entoki nagira aisumbuaya iyiok tene etii oloirobi, netii nunuk, netii esiai nijo orkipei, netii amu yiolo naa orkipei onunuk elee egira aisumbuaya iyiok naleng'.
Among the challenges we used to face is like the diagnosis of diseases. You know, mostly when you don't have to go to the lab, you don't confirm the real disease. When I miss the diagnosis, sometimes my client could lose the trust with me because I just have to go to visit the farm maybe several times treating the same diseases. Even the farmers can see as if you are the doctor is not really qualified.
In the past, we have been having a lot of challenges because most of the time we did clinical diagnosis, which nevertheless never gave us a tentative diagnosis or confirmed diagnosis. So you will use a lot of drugs trying to cover a broad range of diseases. For instance, if you want to treat a disease like anaplas, you also have to cover for a disease like ECF so that you at least you have a wide coverage.
Before the lab was established, scientists would go there and pick samples all the way from Oloitoktok or from Kajiado. And there being no lab, then there was that challenge, such that you would either pick the samples and look for a place to store them, and then bring them all here for analysis.
The Horn Project was a program funded by the UK government designed to increase the capacity of researchers and research institutions in the Horn of Africa to undertake epidemiological research on One Health. And as part of that program, we decided that there was a need for a field forward, let's call it laboratory, which would be able to interact with communities and be a port of call for harvesting samples and providing research results directly back into the community. We worked closely with the University of Nairobi in Kenya, who had already a relationship with that part of the country where they'd been doing a number of small-scale activities over the years. And through them, we identified a laboratory which is based at the Veterinary Services Department of the County Government of Kajiado in Oloitoktok. And we visited this facility, which at the time was basically just an empty room, and we made the decision to invest in turning that into a laboratory.
With the inception of the lab, we are now able to at least now get confirmed diagnosis and know exactly what pathogens we are dealing with. These have been of great importance and help because one, it helps to lower the cost of treatment of diseases, and also it assists in preventing antimicrobial resistance, in that you will treat an animal after you have confirmed what it is, so you use only the effective drugs against the same.
It has brought the One Health integration, where public health professionals, human medics, and even veterinary people, and also the environment people, to be able to appreciate that there is integration where we can know the real world of how pathogens, or rather disease-causing organisms, are moving from the environment to human and to even animals.
One important aspect of the way this laboratory is managed is that we put in the research funding, but it isn't just us as big institutions and external donors putting money into something, reaping rewards and going away. There is a joint investment with the county government, and I think that's a really important part of it.
I see this laboratory going to be a big thing in the future, where many students, both locally and internationally are coming to do their research here.
Going to the future, there are a lot of research areas and gaps that the fact that the facility is there would open up. We may not be able to answer all those questions in that facility, but the fact that the facility is there and we are talking of One Health, and we're able to bring that discussion of One Health in such a setup, for me it opens to many possibilities going to the future.
My hope for the future is now having the lab as a center of excellence, both for diagnostic purposes to help the community and also for research to assist in coming up with critical data that will help inform policy formulation in the future.